So we've had, here at Health Partners, we've had lots of questions, as I'm sure you have and may imagine, about COVID-19 testing. So this short video is an attempt to answer some of those questions that we see pretty much every day.
So, what is the difference between the test for diagnosing COVID 19 and the test to see if a person has had COVID 19 or the antibodies test?
Okay, so first of all, the test that we're all familiar with, the drive up, whether that's Everbank Field locally or the hospitals where you drive up and they use the nasal swab to get some fluid from your nasal cavities, that is the PCR RNA test. That test is for diagnosis of active COVID virus in your system. And it tests for the RNA and replication of the RNA that is associated with COVID-19. So that is what that test does. Now, the other test, the antibody test, which is now starting to come out, tests for IgG, IgM antibodies to the virus. And what that means is when you're infected with a virus, a disease, an illness, your body, other than your sort of initial response, your immune system waking up, it will produce IgM antibodies initially. So they're a little bit more specialized than just kind of our general immune response. And they start to work towards building up a more specific response to that pathogen. Over time, your body then develops IgG antibodies. And those are, if you think about it, the troops at the ready. So they're there. Most IgG antibodies will stay in the system for a long period of time, sometimes lifelong, sometimes conferring lifelong immunity to whatever it was you were exposed to. And that's really the theory behind vaccines, that will then develop these long-term antibodies. Now, do we know whether having IgG antibodies is going to protect us from further or again infection from COVID? Not sure. We don't know enough about this virus. We do know that viruses replicate and morph and change quite frequently. So there is some thinking that even if you do become infected again, if you have the IgG antibodies, that you may be a little bit more able to manage it and wouldn't have quite as severe symptoms.
Are these tests FDA approved?
So in most tests, require a pretty extensive FDA approval process where, one, we want to check for the safety of them, but then two, over time, we'll test X number of people that we know were positive or we know were negative, and we can test the accuracy, and that's a whole long process. Obviously, because of this pandemic, the FDA has rushed through approval of the PCR RNA test, and that's why we're getting such a high number, up to 30% in some cases, of false negatives. Now that's improving as we improve the test, but what we did in this case was the FDA said, okay, get the test out there and then let's work to improve it as we go. The antibody test is pretty similar in that respect. There, to my knowledge, to date, there's only one FDA approved antibody test. There are many companies out there offering this. You can see them online now. But my concern about that, and I, as a healthcare provider, I've been looking for tests to offer to my patients. As of now, haven't yet found one that I believe is going to be accurate enough, that's had enough study subjects, enough testing to determine if in fact it's going to give us an accurate result. Over time, again, that is going to change and going to be improved. But my concern with the antibody test is if you order some online test and we don't know about the accuracy, and then you assume you have immunity, that could potentially put you at greater risk through a change in your behavior that wouldn't have happened otherwise. Now, Quest and LabCorp have both announced tests that are going to be available supposedly next week, the week of April 27th, if you're seeing this video afterwards. And these tests are drawn through a blood draw in the lab and are certainly available through your provider or for our patients of record. I'm happy to order that for anyone that wants. That will involve going into Quest and LabCorp, however, and having that blood draw. And it's a personal risk, depends upon how you feel about it. We are looking at blood spot testing, which can be done at home by the patient. There are a few companies that we have worked with for diagnostics in the past that are going to be coming out with the blood spot testing over the next several weeks. And until I see the studies and really evaluate how many study subjects, what their results were, then I can make that decision. But until then, I'm really not recommending anything else out there. Obviously, Quest and LabCorp are using tests that I would assume have at least some level of clearance to be used. And that's another one, FDA clearance versus FDA approval. Clearance means that it is used for a certain thing. It doesn't make any statements about approval for giving you the results that you would expect from it. So use caution, and again, I think if you're thinking about ordering testing at this point, I would trust Quest or LabCorp over any of these online tests. But again, that's changing, and check back as we get more information, as new tests come to the market and we can evaluate them. We'll send that information on to you. In the meantime, if you have questions about the antibody testing and would like to have it ordered for our patients of record, please give us a call. If you're not a patient of record, give us a call as well, and we can answer any questions you might have about how you can get that ordered. Take care and be safe.